It's really useful to have an ID card in your wallet, or some people wear a med alert bracelet. I think one of the things that makes it easier for that to happen is that I think every operating theatre in the country uses a checklist before anaesthesia. So once you're asleep, everybody stops and they go through simple things. We've got the right patient. Do we know what we're doing? Do we have blood? Does the patient have antibiotics on board? And so on. And that's the time to, I think, for the surgical team to remind their anaesthetic colleagues that they need to make sure that the patient has some octreotide. I think it's still really important when you're the patient to put your hand up when you're talking to the patient, the surgeon beforehand, and say, I need octreotide.
I think that it's part of our group effort as well to liaise with the anaesthetist and their anaesthetic, Irish anaesthetic group, whatever that's called, to ensure that they're aware of it, that there's a protocol available and they should have it on their intranet website, etc. But I just putting the ball back, I think it's the patient education that gets it always across the road. So if you have it, also the stress, as Mark is saying, I think we'll put it on the website, but if you've got a gastric neuroendocrine tumour that's benign, right? And we saw 2 or 3 patients with that, like for example yesterday morning, and we're always saying, you're not on any treatment, you're just being followed up, etc. You don't need to have big doses of octreotide perioperatively and during your procedure. Nor do you need to, for example, if you've got a pancreatic tumour and you're having big liver surgery, it's for the patients who've got that carcinoid syndrome, or for the patients who are new to this group. You're the patients with the flushing, with the diarrhea, sometimes with wheezing if you've got bronchial carcinoids. If you're not sure about it, ask one of us or ask your net specialist that you're seeing for that. Ask for the card and go to the website, and we'll do that fairly quickly so that we'll have that information. We'll put it in red or some big label that only if you've got the carcinoid syndrome. And if there's a doubt about it, you should get the treatment, because it's better to get it than not to get it. I've unfortunately seen in good centres in France when I worked there, I've seen 2 patients die in outside hospitals because of intraoperative cardiovascular crises. You can have hypertension, and it can be very difficult. And even if you have big doses of it, you can have manifestations that are difficult. So we really do need to know about that and take the appropriate strategies to deal with it. And not only for that, for embolization of the liver, it's not only for surgery, sometimes manipulation of big tumours in the abdomen. And we've got rare instances, and I know that Derek had a patient with Chris who was very, very difficult with a very small tumour volume, and we've seen this a few times, it's small tumour volumes that secrete a lot of hormone. We don't know why that is. Normally it's big bulky disease, but if in doubt, use it, I'd say.